Jamie, good to have you with us. Yeah, shall we start by breaking down those figures? Where are we today in terms of cases, and does that necessarily equate to being worried about the spread of Omicron?
Yeah, thanks. Good evening. I think the main thing really is that the case numbers that we're seeing on a day-to-day basis now, several months ago, really, when as soon as the vaccine rollout probably started out, the cases started becoming less relevant than the number of people going into
Mm.
hospital, and then the deaths that come off the back of it. So Omicron, we know from other countries, in particular South Africa, where they saw a sharp rise in the acceleration of kind of the Omicron variant a few weeks back. Is more transmissible. We know that, so more and more people are catching it. But the good news from that is that it seems to be in the countries now where Omicron's dominant, it seems to be kind of killing off the Delta variant, which we know from the studies that are coming out at the moment is less kind of if the Omicron variant is less deadly. So killing off that one could be some good news, but obviously more and more people are getting it. So we've seen, some record numbers of cases. I think that the big issue that we're going to be seeing at the moment now, and we started seeing the figures, is the number of people in hospital,
Mm.
but not necessarily because they're going in because of COVID, because Omicron is less deadly. But if you take the England figures, I was crunching the numbers earlier on, it's probably around 50% of all the COVID patients in hospital at the moment are actually in hospital, but not because of COVID. We've
Oh,
got about 30% of them who were admitted, but they tested positive, but they were admitted for other reasons. So if you kind
oh,
of,
interesting.
yeah, and then we've got a further 20% of patients in hospital who actually caught the virus in hospital. So they went in and they've caught COVID in hospital. So these numbers that we're seeing, and I think we've started seeing in the last week or so, I think we're going to continue to see that because remember now, imagine a scenario where Omicron's so kind of spread so much wildfire that 100% of the population have it. And obviously 100% of the population in hospitals will have it. So he's kind of keeping an eye on those numbers. The difficulty, Claudia, is that obviously if you've got more patients who have got it, even though they're not being treated for it, they have to separate the patients out, and that causes more difficulty. And I think the big concern, I think, in the NHS is more if staff catch it with the self-isolation rules, is there enough people to look after them? That's the main concern.
So when we're looking at also then the number of people dying with COVID, you are seeing a huge drop, not just a fall actually, but also comparing it to cases that the number of people dying compared to what we saw when we had that the spread of the Delta variant, the number of deaths were a lot higher. Is this something that we should be also not focusing on as much, rather actually looking at and actually saying again, this is a sign that Omicron is not as dangerous as and not should not be as worrying as maybe some people would have us think it should be.
No, indeed, in South Africa, we saw this rapid rise in cases, but we haven't seen similar in the past where we saw the kind of the rise in deaths that follow
Mm.
about 10 to 14 days afterwards. We're at that point now where we can start assessing what's gone on in South Africa. Cases have gone up in the UK. Deaths have been continuing to fall. This rapid rise we've seen over the last week. It'll take a few days to feed through to the kind of the death statistics. It'll be at least another week or so before we see that. But remember, the official government numbers are people who've tested positive with COVID-19. So if obviously more and more people are testing positive, I think the interesting thing will be when we start looking at the total number of deaths, because as I say, if everybody had Omicron and anybody who dies tomorrow would be in the COVID statistics. So what we need to do is keep an eye on the total number of deaths over the next few weeks. But all the evidence is really pointing to a less deadly variant, which is obviously good news for the we've got different parts of the country. Scotland and Wales have moved early. They've decided to bring in some restrictions. Got some really strange ones in Wales. I think there was a rugby match was going on Boxing Day where you're only allowed 50 people to watch it outdoors. So they had 50 people watching the match outdoors and 150 watching indoors in the clubhouse because they weren't allowed to watch it. Absolute
Outrageous.
nonsense. So we've got some really strange policies that
Mm.
have been coming in across the countries. I think, Boris is banking on the Omicron variant not being so deadly to not bring the restrictions in, whereas the other first ministers obviously moved a bit early.
Yeah, so then Jamie, who do we believe? Who is acting in the right fashion? Who is responding to this in the right way? Is it Boris Johnson or the other three home nation leaders?
Well, I think that the main thing to really focus on is the evidence. So Mark
Mm.
Drakeford in Wales was talking about a few days ago when he brought these new restrictions in, saying, "Oh, we think the Omicron variant might be more deadly." Research has come out suggesting that it's not as deadly since, and there's been a lot of calls from the Conservative Party within Wales to publish the evidence. Nothing's been forthcoming. I think the problem you're going to have, Claudia, is that when we've seen in the past that people have criticised kind of the Prime Minister or the First Minister for not acting early enough. It's that the inquiry is going to come out and look into all of those things. So some would argue that acting early is a good thing, but I think the more important statistic really is that they're banking on the booster, not just Boris, but the rest of the UK and the first ministers in the other nations as well. And this time last year, over 70% of all the admissions to the hospital were people over the age of 65, and the vast majority of them have already the booster vaccine. There's going to be little to gain from boosting people who are in their 20s with very low risk of going into hospital already. So if you're banking on the booster being the way out of this, because Omicron's not going anywhere, it's going to be here now, it's going to be here in February, it's going to be here in March. If you're banking on the booster, then I think we're in a good place from that perspective. If the NHS did become overrun, then obviously the vaccine and the booster hasn't had the desired effect.
And that criticism of leaders, including Boris Johnson, maybe not acting quickly enough, that criticism would be around the period when there was no vaccine, or at least the vaccine being rolled out the way it has been rolled out now. So when you're looking at then experts, there's different reaction to Boris Johnson not introducing tougher restrictions now. We've had some saying that's the wrong move. However, Professor Sir John Bell, professor at Oxford University, saying that we will not be seeing the mass hospitalisations and deaths that we saw in the dark days. And looking at your figures, it does look like Professor Bell is right.
Yeah, so I think that the big issue you've really got now is that if you you can just Google it, just trawl the websites. Last 10 years, going into the winter, NHS was under pressure. You'd have ambulances queuing out outside. You'd have hospitalisations with patients having things cancelled, operations cancelled, because the NHS just has struggled to cope perfectly over the last 10 or 20 years during the winter months. And we've got this perfect storm now where as soon as you see a little extra pressure because of COVID on the NHS, lots of people, making some cries out to, we need to lock down. We can't go in a position now where the default is to lock down the country because we've got this extra pressure on the NHS. We've had 20 months. You can't prepare and get all of these staff overnight, but we need a long-term plan to sort this out. Ultimately, the vaccine has been rolled out. Omicron, COVID is not going anywhere, Claudia, and ultimately it's going to become a bit like the flu. The good news, I suppose, is that again the flu virus is pretty low prevalence this winter, so we're not having any impact of that overall. The big pressure really on the NHS at the moment is not COVID, it's actually all the catch-up of the last 18 months. And I think that mixing that up with staff potentially having to self-isolate because they've got this Omicron variant, that's the perfect storm for the NHS. So if there's any reason for any restrictions, it's not potentially to be saving lives because COVID is going to kill patients. It's going to be probably potentially saving lives because there won't be enough staff to go in because so many.
Isn't that enough to be worried about what the NHS could look like, what hospitals could look like in all of this? I mentioned earlier we've seen a 38% rise in the number of people in hospital with COVID. You said this could be various reasons, not just because of COVID, but we're still seeing that increase in the number of people going to hospitals. Isn't all of this enough for us to be worried?
I think we should be worried, but there's a difference between being worried and then pushing the panic button and bringing in restrictions. It's probably looking kind of proportionate to what you're going to do, because obviously if the aim is to stop kind of people who work in the NHS catching COVID, well, encouraging them not to go out to nightclubs, the staff there. Why would you need to close nightclubs for the whole population when you potentially could just close off certain parts and kind of get certain people to act more cautiously? The encouraging news at the moment, if you look at Scotland and Wales, we've seen this rise in London. In Scotland and Wales, the number of staff self-isolating at the moment is lower than what we saw at the peak of the virus. I think that's going to be the one to keep an eye out as we go over the next few weeks. But I think for the viewers and kind of the listeners, the most important thing is that all the evidence is pointing towards the fact that this Omicron variant is less deadly. But I think you're probably going to find that you're going to find more and more people that have got COVID because it's more transmissible.
Oh, definitely, Jamie. I cannot tell you. It does remind me of last winter when you do see and hear of the number of people actually testing positive with COVID. But saying that, given all the details you've been looking through, all the numbers you've been looking through, all the numbers you've been crunching, ultimately you think Boris Johnson has made the right decision when it comes to not introducing tougher restrictions before New Year's?
Well, I think with the evidence on the table at the moment, I think so, because it was only about 3 or 4 weeks ago, nobody'd really heard of the Omicron variant, and
Gosh, crazy,
so
yeah.
nobody would have even been thinking of any new restrictions this winter. We've got over 130 million vaccinations in arms across the country. We had Freedom Days across the UK, in the summer months. So who would have thought we would have been going back towards thinking of having restrictions? I think ultimately it depends on what you're trying to do. If you're trying to limit the kind of the spread of the virus by asking people, like in Wales and Scotland, that you can go to hospitality, you can sit down and eat your meal, but then you have to put your mask on when you're standing up. Absolute bonkers rules when you think this is an airborne virus. They come up with some really stupid ideas in those nations, and ultimately, I think some common sense approach for the public. If you're in those vulnerable groups, you're not going to see many people. We've already seen it, Claudia, that people across the country now have been choosing to not go out Christmas parties. They've not been probably mixing as much as they were. So the UK public isn't stupid. I think some common sense will kind of approach. And remember, the young people have had a really tough time the last 20 months. So, letting them have a little bit of enjoyment over the Christmas and New Year period, we know that at low risk. I think the key thing is for them to act with a bit of caution, that if they do go out, test themselves before they go and meet anybody who's vulnerable afterwards.
So where we are right now in England with Plan B, with the wearing of face masks on transport in some indoor settings, working from home, if you can, this is where we should be at right now. We don't need to go any further.
Well, I think the vaccine passports policy has been proven, like in Wales and other parts across Europe, absolutely pointless policy, because some of the areas where they've brought them in, like in Wales, where you had to have one to go into outdoor events, you can't go to some of the sporting events now. And then obviously masks were enforced in Wales and Scotland, and then in England now. I think the working from home obviously is going to have a bit of an impact, because that does actually is one of those key things that stops people mixing, because they're not going into the workplace. But a lot of people were working from home anyway, and we're over that Christmas period now. A key thing that we have got at the moment, which is acting as a kind of a vector to slow the transmission, is the schools are closed, and obviously they're going to reopen now in January.
Yes,
That
of
might kind
course.
of
Yeah.
fill things, because we do know that the vast majority of cases tend to be in younger people. They very
Yeah.
rarely have shown many symptoms, but obviously they pass the virus on. It's like basically if you get 30 children in a class, it's like having 30 households mixing. So we've got those closed at the moment. It might be that if we start seeing the schools go back, we get into the new year, cases get so high that so many people are catching it. So the self-isolation, remember the pandemic that we had, gets so bad that they decide we need to bring something in just to slow the virus spread.
Yeah, gosh, yeah, so such an interesting point, isn't it? Schools are closed. What's it going to be like when they do reopen in January? But Jamie Jenkins, so good talking to you, independent, a statistician.